We have this data that says that half of all mental illnesses start by the age of 14. And yet within our country, we really haven't built out the capacity or the programs or the places for those young people to get the support they need early.
In our local school district, about 45% of juniors in high school report that they had at least thought about ending their life once in the past year, and another 35% had what would be a clinical level of anxiety or depression.
Our systems currently are created for adults, by adults. That's not good enough for our youth.
In Australia, we have what's called the Headspace model of care, and this is what Alcove is based upon. Headspace has been running for the last 20 years in Australia and have 186 centres across Australia.
The Alcove model does its best to reduce as many barriers to services as possible by having a social space where young people can simply exist with no cost and no expectations, creates an environment in which they can feel safe.
Besides therapy, Alcove has 6 service streams. There's like peer support, there's family support, substance use support, there's physical health support, and education and employment support. It's way beyond just normal mental health therapy.
The space is open for just anything. You don't have to come here because you're doing bad. You come here to get better before things get worse.
Models like Alcove allow us to move upstream. So our hope is that a preventive approach minimizes the amount of children and adolescents needing to go to the emergency department with a mental or behavioral health crisis.
I used to be very nervous about things. After I went to Alcove, I started getting a bit more calm, relaxed, and now I have more friends and I know people that I can talk to.
I think it's just a place where they really will see improvement in their kids. And I think any parent would like to have, a kid just feeling themselves, right? In a space that is safe and yeah, I think that's the most important thing.
It was very hard for me to kind of, one, realize that I was struggling mentally, and second of all, being able to communicate that to my family where it's kind of a unknown, kind of a taboo.
Getting involved at Alcove has really shown me it's okay to reach out for help, and there's services and people who truly care.
There aren't that many places for young adults to hang out, so this is one of the spaces that where I can actually be myself.
The Community Health Trust decided to bring Alcove to Watsonville because it's the right thing at the right time for the right people.
Alcove is a very smart investment because young people need to get help early.
It's been proven through some of the other models in Australia and Ireland and Canada, and it's a good investment because it's working.
This is a critical time for us to be able to grow this program for our youth, and we really need broad support from our state, our national partners, our philanthropy partners.
I think if every community could create or have an Alcove, it would be a game changer for youth. If we are really going to flip the switch on stigma around mental and behavioral health, this is the way we do it.